Hello, my name is Micah Johnson. I'm a doctor at Brigham and Women's Hospital in Boston, and with Abdul Al-Sayed, I'm the author of a new book called Medicare for All, The Citizen's Guide. And I'm excited to be a part of this conference and to talk to you today about a topic I've thought about a lot over the last 6 months as I've graduated medical school into a pandemic, and I've been forced to think about all the ways that the healthcare system as set up really set us up for failure when it comes to the greatest public health crisis that our generation has faced. First, I want to talk about ways that our health insurance system has made the pandemic worse. And then at the end, I want to talk about two things that give me hope coming out of this pandemic and moving forward in the fight to make healthcare a human right. First, and most obviously, in the middle of an economic crisis, when people lost their jobs, they also lost their health insurance in droves. Let's be clear, this isn't normal. In most countries, every single person has health insurance before the pandemic, during the pandemic, and after the pandemic. We are unique in having millions of our fellow citizens lose their health insurance when they need it most. And it's not just people who lost their health insurance. There's a lot of folks who are furloughed from their jobs, and when they get furloughed, their employer stops paying their insurance premiums. So not only do you have millions of people who lost their health insurance outright, you have perhaps even more people who all of a sudden are faced with thousands or tens of thousands of dollars in premium bills for themselves and their family in the middle of one of the worst recessions that we've seen in decades. Second is that clinics and hospitals faced financial ruin in the middle of the pandemic. When hospitals were needed most, insurance revenue dried up. And the same with primary care clinics, where thousands of clinics were forced to close, and meanwhile, hospitals even faced bankruptcy in the middle of the pandemic. It shouldn't be this way. When healthcare is run like a business, just like other businesses, when lucrative customers stayed at home, some had to shut their doors, and almost all healthcare institutions were stretched financially. What we want is a healthcare system that is robust in the face of a public health crisis, not one that crumbles when it's needed the most. And third, people avoided testing and treatment for COVID due to the cost. In one survey, 1 in 7 Americans said that they would avoid COVID care because they were afraid about what it would cost them. That's not good for individual health, and it's not good for public health. Especially when we have an infectious disease, we want as many people as possible coming in for testing, coming in for treatment. And unfortunately, our system did not set us up well to do that. But one of the things that I've also thought a lot about in my clinical work is that this isn't just this year, and this isn't just COVID. These problems happen all the time. Even before the pandemic, 30 million Americans had no health insurance. Clinics and hospitals face financial ruin where they're needed most, even before the pandemic. We have a problem with rural hospital closures. We've got safety net hospitals and community health centers who serve the poorest Americans are struggling financially, while the monopoly hospitals are making record profits. And we have people avoiding testing and treatment due to cost for every condition. It's not just COVID. I have patients with HIV, diabetes, heart disease, who are not taking the medications that they need because they're too expensive and they're not getting the testing and treatment that they need. So in many ways, yes, COVID is unique in terms of the scale of the number of people that it affects in such a short time, but it's the same problems that millions of Americans have been dealing with for years and that millions of Americans will continue to face after the pandemic. Medicare for All, of course, would change this fundamentally, both for COVID and beyond. Every American would have health insurance. We would have equity in the way that clinics and hospitals are paid, and we wouldn't rely on highly paying private insurance customers paying for elective surgeries to prop up our hospital systems. We'd be paying equally. No matter who the patient is, hospitals and clinics will get reimbursed fairly, and we wouldn't have to worry about millions of people losing health insurance and not being able to get reimbursed to give that care. And finally, we would eliminate the high deductibles and the other financial barriers to care. So whether it's COVID, HIV, diabetes, heart disease, or cancer, everyone could get the care that they need. But here are two reasons for hope that I have coming out of the pandemic. One is that we see this renewed focus on healthcare workers and not healthcare corporations. I don't need to tell anyone who participates in this conference how powerful the healthcare industry is and how forcefully they will object to major health reforms like Medicare for all. And one of the things that Abdul and I write about in the book is the history of this, how ever since the 1940s, with the Truman single-payer plan, doctors and the healthcare industry have been often the primary opponents to major reform. But things are changing. We've seen in the last years major endorsements of Medicare for all by doctors. And what's happening now with the pandemic? This is very important. We see a split between healthcare workers and healthcare corporations. And here is just one example of medical residents at Stanford who are protesting against their employer about the vaccine rollout. And we see this across the nation, with doctors and nurses sounding the alarm about whether it's the lack of PPE in their facilities, and realizing getting more of a political voice as workers, as opposed to just representatives of the healthcare organizations that they employ. And I think this has really important long-term implications, because hospitals and other healthcare institutions will be very powerful opponents to Medicare for all or other major health reform if we let them. But by having healthcare workers who have been featured at the center of the response to the pandemic take up more political space, develop more of a political voice, and change the positions of the healthcare institutions that employ them, I think this opens up a lot of political possibility for the future. And finally, in very important ways, the conversation around healthcare during the pandemic has showed that healthcare is not just a consumer product, but a public good. And I think this has been a very quiet but important change. And one of the things that Abdul and I write about in the book is we argue that for at least 40 years, the dominant way that we have thought and talked about healthcare in America is as a product. Even the Affordable Care Act, what it essentially does is give tax credits to support buying private insurance on a new competitive marketplace. That is a very consumer product oriented way of thinking about healthcare. But what's happened during COVID? Very quietly across both sides of the aisle, when we think about the vaccine, we're not talking about it like a consumer product. We're talking about it like a public good. We're not charging people out of pocket. There's broad consensus that this is something that should be available to everyone because they need it. And then if you look in President-elect Biden's platform, we've got the idea that all testing and treatment for COVID, when you go into the hospital or when you go into the clinic, that should be free. This is a very important opportunity because the way that we're talking about COVID care in this country is fundamentally different from the way that we've been talking about healthcare for the last 40 years. And that opens up an extremely important opportunity for reforms like Medicare for all. Thank you so much for joining. I'm very grateful to be a part of this conference. If you want to learn more about the topics I talked about today, I hope you'll consider checking out Abdul and I's book at medicareforallbook.com. It comes out on February 1st. And please don't hesitate to get in touch if you want to talk about any of these ideas further. Thank you all so much.